in the medical field? Is it a little different at all the way you treat them?
Well, we still treat them based on the symptoms, but again, it's the degree of symptoms that we encounter that makes it very challenging to treat. In the worst case scenarios, of course, the agitation. I mean, these are people, when they're so agitated, they almost have superhuman strength. You heard about a couple of days ago when someone destroyed the bathroom at the gas station. And often in the hospitals, patients become so violent that they rip out sinks and punch holes in walls, which in a sense is very destructive, but also put themselves at risk because the body can't take that kind of punishment. So I think that's what's scary about treating these patients. We need high doses of medication, which in turn has its own complications. So, and then of course there's other medical aspects such as risk of heart attacks, seizures, and so forth.
And they say, a seizure, it could be fatal. Mm-hmm. These things could kill you. So this is a deadly drug.
It is. Yep. People have stroked out on this stuff, and again, it doesn't have to happen at the time they actually use it. It could actually happen, hours or days afterward, because the problem with this drug is just lasts for a while. So just because they're okay for the first few hours doesn't mean they're out of the danger.
And Jesse said, he had done other drugs for 10 years. He did this drug for 3 weeks. And he said it had more destruction on his body than those 10 years. How scary is that?
I think that's some of the calls that we're getting, as Chief Gatch said, from are not just police calls. They're welfare checks, they're concern checks, they're medical calls. We too have had to change our policies. Although this is predominantly in the greater Bangor area, we're seeing it in the small communities on the outside of Bangor. And we, being rural officers, have had to change our policies to respond to not allowing first responder medical people to respond to scenes like that until law enforcement can be there to assist them and evaluate what's going on.
And a note on that, you guys aren't just here to deal with bath salts. You have other calls, other emergencies you need to take care of, and now you have 2 people that you have to send to these calls. Is that putting a stress on your agencies?
Absolutely, it puts a stress on our agencies. We are responding to calls involving bath salts much more than we've responded to calls involving other drugs, of all other drugs combined in any given period. It puts a tremendous stress on our officers, on our resources, because when we're sending officers 2, 3, 4 times a day to these incidents and tying up 2 officers at a time, they're not available to do the other business that they're out there and that their duties we have to train our officers differently. It puts a strain on our command staff to make sure that our officers are prepared for these calls. It puts a strain on our dispatchers who are taking these calls and need to make sure that they get enough information to pass on to our officers so that the officers know what they're going to, and yet when they get there, they're still not sure, and they won't know until they start to talk to the person and interact, and it's very unclear as to what the officers are going to be encountering when they get there.
That said, too, is there a time when you should call and when you shouldn't call on bath salts? I mean, just because you think someone is on bath salts, is that a reason to call? I know it's a fine line because you don't want to say no and then have something happen.
No, what I have told people, and I will continue to tell people, is we would rather be safe than sorry. We want people to call. If you see somebody suspicious, if you see somebody acting strangely, if you know that somebody's on bath salts, we appreciate getting the phone call. I would rather send those 2 officers to the call and make sure that everybody is safe than not send officers to a particular incident or a particular call and find out that somebody has gotten hurt. So I encourage people, call us when you see these things. It puts a strain on us, on our resources, but I'd rather have it that way because the alternative could put a much greater strain.
And as you said, we're not just seeing this in Bangor, it's other places too, but Bangor seems to kind of be the hub of it right now.
Yeah, early before I think that we saw it in Bangor, we actually saw it in northern Penobscot County in a number of 5 to 7 calls, and then it seemed to have kind of gone away for a while, and then absolutely in the greater Bangor area. But up in the Howland-Lincoln areas was when the Sheriff's Office had its first experiences with this, and to be quite frank, as Chief Gatch said, we weren't prepared for it. Some of the officers didn't understand exactly what we were dealing with at the time. I am pleased to think that law enforcement, medical services, the community have come together to to work on this. This is clearly a community problem, and it's nice to see that everybody's coming together here, trying to address this problem and understand the severity of it and how dangerous this stuff really can be.
Well, that's a good point. We don't want people to say, well, this doesn't affect me, because we're seeing that it's affecting everyone.
I think the perception sometimes people have is that when it's drug use, it's only people who use drugs already or who have some other kind of problems, be it psychiatric, or people who are lower socioeconomic class, kind of thing like that. And it's not the case. I mean, there are people who use it anywhere. I mean, there's the nurses, from other places that use it, professional used it. People may use other drugs that may have been mixed with this stuff. So it's very, everyone's vulnerable to this. Either it's a direct victim or indirect victim.
Thank you. Well, we sat down with addiction specialist Dr. Scott Davis. Dr. Davis comes to Maine from the Betty Ford Clinic in California. He's an expert on drug addiction and has a lot to say about bath salts. Ask Dr. Scott Davis about the designer drugs known as bath salts, and he won't hold back.
It is a nasty drug. I kind of describe it as PCP on PCP. I mean, it causes hallucinations like LSD used to, equal to or even more so than cocaine.
He's an addiction specialist who says addiction is a disease and something that takes time to recover from.
To say to someone, well, just stop using, just snap out of it. That's like saying to a diabetic, stop being a diabetic, come on. It doesn't work that way. I'm an addiction specialist. I see patients who are addicted to their drugs. The horse is already out of the barn, so to speak. And it takes much more work, months, years of work, including therapy, to help right someone on a healthier path.
Davis says when someone is using bath salts, there are lots of consequences, including hallucinations, paranoia, even death.
What these drugs do is that they literally turn off the judgment centers in the brain. Maybe their very first use that causes the seizure that's going to kill them.
He believes education is key to combating the drug problem.
In that we're in this wake of a bath salt epidemic, it's very important for people to know just how harmful these drugs are, how toxic they are, how they affect the body.
He also points out there is help out there if you or someone you know is struggling with addiction.
There is effective treatment available, but the first step is recognizing that someone has a problem and taking the step to address it.
Davis says the bath salts epidemic has been difficult for people in his profession because there isn't a quick way to test for the drug in someone's system. He says they are developing faster ways to identify the drugs. He calls this an epidemic. Is it fair to say that this is an epidemic?
I think that's accurate because, this is a public health emergency, for lack of a better word. And we have a wide community that's being affected. And it's almost like an outbreak of, let's say, a bad disease. And we need to do something immediate to fix this. Rather, it's prevention, intervention, and also keep it from happening again.
Some people say maybe talking about it too much is a bad thing. Maybe that's encouraging people to try it. What do you three say to that?
I say, I don't think we can talk about this too much. It's out there. It does not help to bury our heads in the sand. This is a problem. It's been a problem since certainly earlier this year, and it's getting worse. And as I said before, it snuck up on us. And we have an opportunity now to act so that we can put some sort of a ceiling on this so that we can control this from getting so out of hand that it escalates into a much more serious problem. So we need to make sure that people out there, for their own protection, for the protection of the users, for the protection of our children, we need to make sure that people are educated. They know what this drug is, they know what it does. I still have people coming up to me saying, well, I stopped using bath salts. I stopped buying bath salts in the stores because I was afraid it might be absorbed into my skin, through my skin. That tells me that the general public is not well educated in this right now, and that's what we need to have happen.
I mean, I agree. I mean, this is an important public health message that needs to be constantly repeated. You know, I think it's in a way, sometimes people need to hear it a few more times before it sink in. You know, the first time is okay, no big deal. Second time, okay, maybe I'll hear it a little bit more. And then your third, fourth time, it kind of drive home the message. And as the chief said, there's still people, I mean, despite the, the aggressive media campaign in terms of educating people, there's still people who don't know what bath salt is. And as long as there are people who don't understand that, we're not doing enough, I think. We need to do more.
We know that this is absolutely affecting everybody. For those who think, I'm not a drug addict, this is not going to affect me, I may not put myself in those situations. When you respond to the hospital and you need to go to the hospital yourself for a medical situation, and you show up and law enforcement's had to bring 1 or 2 or 3 people under the influence into the emergency room in our local hospitals, it could affect you. I mean, that's just one example where it affects you. And we feel bad for the, this is not just medical services and our treatment facilities, but our hospitals are bearing a lot of this load on dealing with people that are under the influence.
And I'm assuming, Dr. Ng, that it's dangerous for the medical professionals too, just as it is for the law enforcement.
Extremely, because again, law enforcement certainly had to do a lot of agitation behavior in the past, but the medical professional, we're trained to heal, we're trained to take care of people, not to restrain people because they're combative. We'll do what we can to help them, but still, it's a very different environment. And in the hospital setting, you have a lot more other things to worry about. The equipment that people can bring, bring a table, and there are other patients they got to worry about. So it's very challenging to help a professional to deal with this in as safe a manner for the patient as possible.
Do we know why, or are there any ideas we can come with to why it's such a problem in Bangor? Why Bangor seems to be the epicenter of this?
I wish I had a real good answer for you. I don't. I can give you reasons that I believe contribute to that. One of them is the drug was legal up until a few months ago, and the laws currently don't create much of a deterrent. Because it was legal, it was easy to get. So easy to get. Known users seem to be the ones that are taking it right now. That is starting to migrate into some experimental users and so forth, but initially it was known users. So they're looking to get a high. It's a cheap high. The deterrents aren't very strong against using it, and it's readily available. Those are 3 primary reasons why any drug comes to a particular area, and I think that if I had to make a real educated guess, that's why we're seeing it here right now.
And when they're selling it, there is a disclaimer on it. It'll say plant food, not for consumption. So is that a way of getting it, if you're selling it, but you're selling it as plant food, you're not selling it as a drug, these people can't get in much trouble?
It bypasses the laws that the FDA has for the sale and consumption of materials by humans. So by putting that on there, it simply bypasses the FDA laws. The federal laws have not been put into place yet to ban this, so there was no deterrent from that end, so that the manufacturers and the people who were making this and shipping it over needed to find a way to circumvent those FDA laws, and that was the way.
And it was legal for people to take it, so there was nothing, your hands were tied there too.
And our hands are still tied to some extent, so yes, absolutely.
Because now it's just a misdemeanor right now?
Currently for possession, it's a civil infraction punishable only by a fine, which means if we find somebody who is simply in possession of bath salts, and there are no other crimes that they're committing, we have no right to arrest them. We cannot arrest them for it. All we can do is issue them a summons, and if they're found adjudicated as having been in possession of it, then there would be a fine levied against them.
And we're going to talk about that later. We're also going to hear from Governor LePage on what new laws he wants to put in place. And when we come back, we're going to talk to folks at the University of Maine and Huston University and the Bangor school system to see what they're doing to try and keep the drug off of their campuses. We'll be right back.